Hi, I'm Rochelle at the Athlete Center. This video is going over a dissociation through the trunk and the pelvis when running and walking. So dissociation is our ability to stabilize one joint or one area and move another. So this specific video is practicing stabilizing through our trunk, so our rib cage and our pelvis, while being able to move our hip and the rest of our leg to generate force to move forward while running and walking. So as we move forward while running and walking, we need hip extension, knee extension, and ankle extension, or what's called plantar flexion. So we're having our hip, our knee, and our ankle all work together to help us move forward. If we can't dissociate, so isolate that motion from what's happening up here, we can end up wasting energy or creating compensations and have some extra movement here while maybe this isn't doing a job. So if we have pain in the ankle, the calf, the knee, the hip, or the low back, this could be a factor if you're running or walking. So what we're looking at here is being able to create hip extension without losing stabilization through here. So what we're going to do is start with finding this place where our rib cage is stacked right over our top of our pelvis. So we're going to associate, so we're going to have our pelvis and our rib cage work as one unit. So they're going to stay together. They're going to be associated. And we have a bunch more videos on how to do this that are a little bit more detailed. We're going to try to breathe into our thumbs. So breathe into our lower back. Breathe laterally into our palms. And breathe anteriorly into our fingertips. So we're going to use that pressure of our breath to create some stability in our trunk. So now we're going to practice this sitting. A couple breaths, maintaining some pressure out here without losing this rib cage over pelvis. Now we're going to see if we can practice it standing. So creating some expansion while maintaining, again, rib cage over pelvis. So if we breathe in and expand and our ribs come forward and we start to arch through the low back, now we've lost that control and that association here. So it's going to be harder for us to dissociate with our leg as we push off. So we're going to put our thumbs on the bottom of our rib cage and our fingertips on the top of our pelvis, and we're going to try to maintain that distance. So we're going to come to the wall and do a bit of a hip hinge. So as I send my hips back, so hip flexion, we're going to maintain this distance, and then as we come up into a little bit of hip extension, we're going to try to maintain this and avoid having our ribs pop up and our low back arch. So this would be us trying to create hip extension in our low back. So if we can control what our low back's doing, it's going to be easier for us to generate power through here. So we're going to practice using our hips and knees. So that's 2 parts of the 3-part system. Once you feel like you can maintain your trunk position and your rib cage position, creating that power with your knee and your hip, we're going to add the ankle. So we're not going to make this a balance exercise. We're going to use the wall. So finding that trunk position first. We can inhale here, make sure our ribs don't pop down and we don't create a little bit of lordosis. So maintain this position, and then as we come into our hip extension, our knee extension, we're going to add a little calf raise. So what we are trying to avoid here is as we add that calf raise, we're going to try not to let our ribs pop up and arch through the low back. So keep these guys hugging down. We're going to go into a little bit of hip, knee, ankle flexion, and then come up into some extension without using our low back. So I'm just using the wall as a little bit of balance assistance here. So inhale, expanding through the low back, trying to breathe here without my rib cage popping up and dropping into a little bit of lordosis. Inhale, and then exhale, coming up. And then a progression of this would be doing a single leg version or doing a loaded version. But again, this could be helpful for someone with low back pain, with hip pain, with knee pain, with calf or Ankle pain. So we are dissociating our limb movement from our trunk movement to generate more power using our hips, hamstrings, and calf.